Welcome to the first episode of Decoding Healthcare. My name is Richard Girardi, and I'm going to be your host on this show, where we're going to explore some different methods of complementary, alternative, and integrative medicine. Part of my professional background has been in making technical and medical information a little bit more digestible to the average consumer, and as someone who has struggled with understanding many of these topics myself, my goal is going to be to help clear up some of the confusion and myths out there so you as a consumer can make an informed decision in your own healthcare. We're going to do that by bringing in some expert practitioners, topic experts, patients with some really, really cool stories, and even through a little bit of history in healthcare in the United States. So let's get started by welcoming our first expert, Dr. Patti Giuliano from Westwood Family Chiropractic. Dr. Patti is one half of the ownership with her husband, Dr. Peter. They've owned Westwood Family Chiropractic for 35 years, if that's correct. Right?
35 years.
35 years, considered one of the largest family chiropractic practices in the world. Is that right?
That's what I'm told.
That's what you're told. Great. So
Yes.
Dr. Patti is also the president of the League of Chiropractic for Women. Is that correct?
League of Chiropractic Women. I am the past president now.
Past president.
Yes.
Okay.
Yes.
And did you start that organization? Or?
I did. 14, not 14 years ago. 2012. We, 14 of us got together. Not all women chiropractors, but women in chiropractic. So that would include women who are in the administrative aspect of chiropractic, working in chiropractic schools,
Yep.
as well as women that work in chiropractic offices as chiropractic assistants.
Gotcha.
Yeah, it's a profession.
Okay.
So,
So
yeah.
you guys are both international speakers. I know Dr. Peter is always out and about speaking at places around the world. So you guys are kind of a big deal in the world of chiropractic. So
I
I'm going to
guess
say
so.
that for you because I know you
Thank
are,
you.
and I know you wouldn't say that.
Yeah, yeah.
So my goal today was really to, I am married to a lovely woman who has
are.
studied multiple modalities of complementary types of taking care of yourself. And before I met my wife, Christine, I really wasn't exposed to any of that information. So there was so much confusion on my part. But over the last 18 years with her, I've really learned a lot about what other ways we can take care of our body. And what I wanted to do is expose that to people that aren't necessarily going to just go into the doctor or a chiropractor or someone else to ask questions. They really kind of want to do some research first, and everything we read on the internet is true. So the problem is, I think sometimes we go out there and we do research, or we see information out there that may push against different methods of taking care of our body. And I wanted to sort of dispel some of those myths as well.
Yeah, I think that's a good idea.
So I know that my first time going to a chiropractor, especially in your office, I was very surprised to go in there and see kids running around and lots of different families. I think my image walking in was I was going to see a bunch of people with neck braces on from car accidents and a bunch of construction workers holding their backs. I think that was sort of like the stereotypical view of a chiropractor.
Yeah.
So my first question is, what does a chiropractor actually do, and why would someone see one?
Okay. So let's first, can we put it in perspective first?
Yes.
Because you talked about health care. So what is health care? So I like to put it into three categories. There's crisis care, there's health care, and then there's self-care, okay? And so crisis care is you go to a doctor because something's going on with your body, you don't know what it is, and you need some help, and you're not sure what it is. Most people go to medical doctors first because that's what our society is, that's our culture.
Sure.
And a lot of people go to chiropractors and go to other, quote unquote, we'll say alternative, complementary types of practitioners, people that they perceive can help them with a particular thing that's going on with them. Healthcare, that's something that someone can do for you. It could be a doctor, it could be a dentist, it could be a dental hygienist. They do something for you to help the well-being of your body. You get your teeth cleaned. People come to us to get their spine checked. We call it a tune-up. And then you've got self-care. Those are the things that we can do for ourselves. So here we are. Medicine mostly lives here in crisis care and first aid care. We call that health care, and we have insurance for that. Then you have people who want health care, and a lot of that is not covered by insurance, because it's like your bottled water is not covered by insurance. Going to a health club, in some instances, some of it is paid for. Going to a chiropractor, acupuncturist, massage therapist, part of healthcare. But here's the thing, you can do things for healthcare that you can do for crisis care, right? You have a heart attack and they say, oh, we're gonna give you rehab, and the stuff that you do for rehab is stuff that other people do just to keep their bodies healthy.
Right.
So people can go to chiropractors because they're in crisis care, and that's what most people think about. That's what you were saying. People come in, they have neck braces on, and they have back pain, and they're older. But in this realm here, you can do chiropractic care for somebody in crisis care, and it can look the same as what we do for people for health care. So what do we do as chiropractors? Essentially, we want to make sure that your brain can communicate with your body, and your body can communicate with your brain. And your brain and the connection to our body is called our spinal cord. And if I had my spine here, if I could take it out, I can show you. And basically, it's completely encased in bone. And it's the only system in our body that is completely encased in bone, because we know that people can injure their spinal cord, right? And what would we call that if somebody injures their spinal cord, typically?
Just was it subluxation, or is that a?
Oh, well, if somebody has like an actual injury to the internal part of their spinal cord, where it's cut, or people become paralyzed.
Right.
So what happens is it interrupts the messages from the brain to the body, so they can't function. The messages aren't getting to parts of the body, so they're not going to work, right? But you also can't sense those parts of the body either, right?
Right.
In chiropractic, we look for something that's more subtle than somebody gets, their spinal cord cut. What happens is the bones of the spine can start growing in a way from birth and birth traumas to all the traumas that our kids go through. Think about your daughter when she was learning how to walk. How many times did she fall on her butt, fall on her butt, fall on her butt?
Right.
How many times did she come butt first down the stairs?
Exactly.
All our kids do that, and it has an impact into the spine. And the spine of these young ones is more like the cartilage in your nose until about age 10. So it's forming itself, it's lining itself up one vertebra to the next vertebra, and if it lines up twisted like that, you're stuck like that for life. So chiropractors recognize that with all the study that we do in school. We go to school for 4 years of undergraduate, then we go 4 years of chiropractic school. And in those 4 years, we are studying, most importantly, the nerve system and the impact that the bones have on the nerve system, and the impact that the muscles have on the bones, because muscles move bones, and the ligaments, how they're supposed to hold everything together.
Right.
So we study all of it integrated so that we can do what we do, which is to evaluate whether the bones of the skull and the bones of the spine are altered in such a way that they're jammed up, and then they start causing pressure to go internally to the spinal cord, either through swelling or the discs or whatever other tissues. And that swelling doesn't cut off the nerves, it squeezes the nerves. So it's like it does this. So I can still talk, but the voice is not coming out as best as it could.
Sure.
That is what happens to people's spinal cords from birth until their last breath.
So I remember, just as a quick story, when I first met you, my wife was pregnant with our daughter, and she had a issue with her pelvic area, and she couldn't walk, essentially, during her last couple of months of her pregnancy and after for a while. So I would literally come home from work, I would pick her up, carry her into the car, carry her into your office, carry her, put her onto the table, and you guys would adjust her, and eventually she felt better, and she's fine now. But I remember when our daughter was born, you came to our home, and it was in February. It had just snowed. The Super Bowl had just happened. We lost. But you came to the house with your portable table, and you gave both my wife and our daughter adjustments. So I get it. That makes sense to me now, because I had not heard it explained like that before, where the bones are sort of like the same strength as your cartilage. And, and I do remember her, boom, 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 down the stairs multiple times, either for fun or on accident. But there's all those stresses, so I understand much, much better now why people bring their babies to a chiropractor. That makes total sense.
Yeah, and we have special training for that too. You don't take care of babies the same way you take care of adults.
Right.
And some adults, you don't take care of them the same as other adults. Everybody is very unique. And you learn in school and then through your clinicals and your practice. I mean, 36 years now, I've gotten quite proficient. I have to keep reminding myself, wow, I really, I'm learning. I've learned a lot.
Right. And you guys, so you don't just, you do babies, you do from all walks of life, from birth to the end, you guys do everybody.
Well, I tell people, if you have a spine and you're alive, you can go to a chiropractor, because we are subjected to stresses. The stresses we don't think about, gravity. Right now, gravity is pushing down on me. It's pushing down on my spine very differently than when I stand up, pushing down on my spine very differently when I'm laying down.
Right.
And ideally, against gravity, you want to be as erect as possible so that the weight of gravity comes in equally. But if I'm sitting like this all the time, then the weight of gravity is coming in very differently, right? And it's going to put stresses on my bones. And if I do this repetitively, my spine is going to grow very different. Your spine and your structure will grow based on the positions that you put it in the most. And I know you want to talk about tech-neck later, but the positions we put our bodies in the most, we're mostly sitting and flexing, our bodies are going to start growing into those positions. If we do that, we go to stand up, and as we get older, we're going to be more bent forward.
Right.
So I teach people about extend your body as much as you can, because...
Well, I think that's what people are looking for. They're looking for those, like, look, there's certain elements of our lives we cannot change. We're going to sit down at work. We're going to use our phones, and we'll chat about that in a little bit. But we want to be. I think people want to be healthy. They want to be better. A lot of people want the quick fix. They want to take something that makes me feel better, but doesn't necessarily fix the problem. But I think most people, if they can be given a reasonable task to do to improve things, I think they're looking. They'll do it. But they just need to kind of know what those things are.
Yeah.
But so
I would hope so.
Yeah. So, but you guys do, kids, but you also, in your practice, and I love this part, you guys do animals as well.
Any human or animal that has a spine and has a nerve system and is alive. Yeah. So my husband takes care of the animals.
And I remember when Dr. Peter explained to me, he's like, look, pets can have the same stresses and injuries as humans. They have a spine. Why can't you adjust them? And I think of like a placebo effect, right? The placebo effect, whether it's a kid or an animal, for a regular person, you give them a pill, a sugar pill, you tell them it's the newest, latest, greatest medication, and you feel better.
Right.
That doesn't work with pets and babies. They don't have any clue. They either feel better or they don't.
Right.
And we bring our dog, Bailey, who's a little Cavalier King Charles Spaniel. We've been bringing her for a number of years. And I know Dr. Peter does that as sort of like a service for a donation, a one-time donation, which is amazing because he loves to do it.
Yes.
But I just recently, actually in the past couple of months, I went upstairs. My dog was laying on the bed and she wouldn't come downstairs, which was unusual for her.
Yeah. Yeah.
And I said, come on, let's go. And she wouldn't get up. So I picked her up and I put her on the floor, and she collapsed. She was completely down, and she couldn't get up. So I kind of panicked because I know she'd had problems with her hips in the past, and Dr. Peter had helped with that a lot.
Right.
And so I called in a panic. Dr. Peter saw her, and when I brought her to him, he's like, yeah, put her down on the ground. And I think he was surprised too that she had collapsed.
Right.
But she looked up at him and her tail was wagging because every single time she comes to see him,
Mm-hmm.
she literally jumps out of the car. She doesn't run to me, she runs straight to him because she knows every single time she sees him, she feels better. And after he adjusted her, she wasn't 100% fine,
Right.
but she got up and she wobbled away and she looked back like, thank you. You could see
Yeah.
it in her face. And I thought that was such the coolest sort of testimonial to what chiropractic can do, because again, when you see those miracles,
Yeah.
it really does sort of click in your head that this is science based. And I think this was one of the questions that people asked.
Yeah,
But
it's-
what would you say about when someone says is chiropractic science based, or is it?
Well, let's put that question aside for a second.
Okay.
Let's go back to, is it chiropractic really? Everybody likes to give credit to the doctors and the method and the therapy or whatever it is. And I feel like the greatest gift that I can give anybody is to remind them that you have a strong body, you have a healthy body. Your body knows how to heal you. I mean, really, you get a cut, you can put a Band-Aid on it, you can do all that, but your body ultimately is going to heal that. The animals that Peter adjusts, the babies, the people, and you talked about placebo. Yes, Peter has adjusted many animals. Some of them have been paralyzed. So that's the crisis care aspect of it. And he'll adjust them and they will jump up and start walking. So is it magic? Is it a miracle? The miracle is inside of us living beings.
Right.
And our living beings, we have within us this invisible genius. And this genius basically uses the brain and the nerve system to keep us alive. And it always strives for survival. So when we adjust a human being or an animal, what we're doing is we're removing an interference. It's just like slapping a kid on the back who swallowed a penny and it's stuck in their throat and they can't breathe. Well, you slap them on the back, the penny comes out. Do you tell the person, oh, you are so great, you are a miracle worker?
Right.
They removed an interference. So that's how I look at what I do as a chiropractor. I don't heal people. People heal themselves. But if you have pressure, a stronghold being squeezed on your spinal cord, your body cannot get all the messages it needs. That will affect every system in your body. Your nerves go to your heart, your lungs, your liver, your kidneys, your immune system. Every cell in your body is connected by some way, shape, or form, directly or indirectly, to your brain. So if signals aren't getting through, and then all of a sudden, I tell the kids, Dr. Patti's going to turn on your power switches. We're going to make sure all the light switches are on in your body so your brain can see what it needs to do for you. And then when people say to me, thank you, Dr. Patti, you made my headache go away, or you made my back pain go away, or you made my kids' ear infections go away, or you made my wife be able to walk. I look at them and I say, well, thank you, it's a partnership, but I couldn't do it if you were a slab of beef that came in
Right.
here, There has to be life inside your body, and what we do is we make adjustments, very gentle pressures along the spine in a very specific way, based on a very specific analysis that tells us we need to push here and then there, and then we look and we say, oh, okay, because we did that and that, the body's doing this, so now we need to do this and this. So we read the body and we give the body, based on what we're analyzing, what it needs, where it needs the pressure. And we make those adjustments to allow that body to heal itself from the inside out as best as possible.
Right. Okay.
That's the biggest gift. And that's this. That's
Right.
healthcare.
Right. Right.
Because I want people to be empowered.
Right.
So that,
There's so I think about what are the expectations that you set for a new patient that comes in, or a new family, as a goal, as a philosophical goal, or if there is an injury, if someone says, well, I've got 12 visits, or can this be healed in 7 visits?
okay.
What do you sort of tell people when they sort of come in with that expectation? Because I think that's sort of
yes.
one of the misconceptions of how chiropractic works.
Yeah. I address that right up front when people say, you know, and I'll say to a patient, you know, I know people say that we keep you coming forever, and you can go ask any of our patients that have been seeing us for over 30 years if I put a ball and chain on them and force them to do that. I think that you have to make, if you want health care for people, you need to make it affordable and you need to make yourself available. And we've always done that. And we've created fee programs in our office, options for people to be able to get all the care they need for a set amount. And that has worked for us since 1984 in this practice. And it's one of our unique factors. So affordable, available. People have insurance, and insurance is going to pay for this. Very limited,
Right.
okay? And this, like we said earlier, is not often covered. So, we've always strived to allow people to see why. Why would somebody keep coming to a chiropractor? And I guess the best analogy could be, well, a couple of analogies. Why do you keep brushing your teeth? Why do you keep exercising for the rest of your life? And probably
Right.
exercise is closer because you're working with the same tissues. You're working with muscles, you're working with ligaments, you're working with joints and bones and all of that. And what we know is if you're going to start a training program to build up your body, you're not going to go once a week. You're going to go 3 to 5 times a week. And why? Because it takes time for the body and the brain to get connected. Ask Tiger Woods, ask any Olympic athlete. It's repetition, frequency, repetition, frequency.
Right.
So somebody may come in to me here in crisis or here where my baby was just born and they were pulling on their neck. Can you check my baby's spine? And then we will do the analysis that we need to see where is that spine at, what kind of trauma was done, and what do we need to do to help them here, and then let's bring them to here so that for the rest of their life they can have full access to their nerve system working as close to 100% as possible. But how do we know? We take x-rays, usually over the age of 17, 18. Sometimes I'll do it younger because nowadays the kids' necks are actually going in the opposite direction than they're supposed to be for their health and well-being. We know, according to all the textbooks, you're supposed to have a 17-degree radius curve. So that means a curve going forward in the neck. So that when I feel there should be an arch in the neck going forward, an arch in the neck and the lower spine going forward, and the mid-back coming back. And when those curves are altered, you are putting tension on the spinal cord. And according to all the research, if you stretch the spinal cord and it stays in a stretched position, you are more prone to pathology. That's according to research. And so I don't want that for people, and I don't think people want that for their kids. So the whole tech neck thing where if you're in this position 90% of the day, your spine will grow into that position, and that's what we're seeing with kids.
Right.
So let me just complete that.
Yeah,
When
yeah.
we look at x-rays, we are trained in chiropractic school. I can look at an x-ray and I can tell you if that joint was damaged 5 years ago, 20 years ago, 40 years ago. So if somebody comes to me at age 40 and they've got injuries to their spine that I can absolutely tell them for sure this happened 40 years ago, and they can usually say, wow, yeah, I know I had a traumatic birth, my parents told me that, or yeah, I know I fell off my bicycle when I was 6 years old, and my neck was stuck like this for a while. We can tell by looking at the x-rays, but I've been doing it so long that I know what it feels like to their muscle tissue and what it's going to look like on an x-ray now after doing this for so many years. So if somebody's been injured for 40 years, can you expect that you're going to be able to correct that problem in their spine? They may feel better after a few adjustments, yet is it really corrected?
Right.
So that's the question, and that's why a chiropractor would recommend to somebody, okay, we need some initial care here that's more intensive, and then over your lifetime, it's a good idea for you to visit us on a regular basis. And I know for myself, my parents are 90 years old. I get my spine checked once a week. My kids get their spine checked once a week, and they're in 29 and 31. And my parents at 90 years old get their spine checked every Tuesday, 11:45 in New Jersey, because they don't live near me here.
Right.
And they have a wonderful chiropractor who
Well,
cares for them.
That's a great analogy of, like, next month when in January, when everybody goes back to the gym,
Right?
we'll go for, I think it's on average, we go for 6 to 8 weeks. And in, May, when we want our summer bodies here in New England, we'll be upset that we didn't get them because I went to the gym and didn't work, and because I went for, 7 weeks. Or I did go for 3 months and I got my 6-pack back, but then the summer came and then the cheeseburgers came back for the barbecues and I didn't go to the gym as much, and it came
Yeah.
back. And it is a maintenance.
Yeah.
There's a maintenance
We're all
element to it.
human.
Right.
We're all human.
Right.
We fall off the wagon and we get back on. And
Well, I know
Yeah.
that I've been coming to your practice with my wife for 11 years. And I've had numerous injuries myself, and I'm in very good shape. I've had injuries where literally it felt like my head was, collapsing, that my neck was collapsing, and had tried some other methods to heal it, with cortisone shots and different things like that, which really didn't work. And I feel great. I mean, I get regular adjustments, so it's been really helpful for me. So,
and it doesn't mean that you don't ever injure yourself again.
Right.
When I get hurt or something, my patients go, I think you need to find a good chiropractor. And I'm like, yes, I get my spine checked regularly. But yeah, I injured myself. I need to let those tissues heal too.
Right.
And I go to other practitioners. I see a PT on a regular basis, and she does different things than what I do as a chiropractor. And a lot of people confuse that. They think chiropractors and physical therapists do the same thing. Well, that could be the case with some chiropractors. It's not the case with us. We do very specific, pure chiropractic, and we adjust the spine based on certain analysis. Somebody can come in my office and tell me nothing. Like babies don't talk to me and tell me. I have to have a system of analysis to know what do I do for this baby to help this baby be as healthy and strong as possible, to take pressure and interference off their nerve system. And I can do that with every adult. But to understand a person's, people want to tell you their symptoms. And it is information for me. It's not like I don't want to hear it. I want to hear what's been going on for them and what are they sensing in their body. And I help people make sense of their symptoms. I can't take them away. I mean, people say, can you make my pain go away? And I joke and I say, well, the only way I could do it is if I cut your nerve that's sending signals to your brain saying there's a problem. Pain is information, and we want to block it and make it go away. And all too often, if you keep blocking that pain, you have things festering inside of you you don't know is happening.
Right.
And it could get worse over time.
I think an important part of what I've learned, with my wife over the years is, if I have an injury and I go to my doctor, he gives me a really powerful medication, I'm going to feel better. But it doesn't necessarily mean that I fixed anything.
Right.
He just gave me something so strong that it's going to fix that, it's a Band-Aid. And
It's going to block the symptom.
it's going to block the
Okay?
symptom.
And
But-
with all due respect, that's the practice of medicine.
right. And we look at...
We can't make them wrong.
No, absolutely.
know.
And there is a mindset that you really need to we have a specific mindset with traditional medicine.
Right.
And it's very different on the other side with chiropractic and other,
Right.
different.
It's here.
Right.
Yeah.
And we really have to believe that our bodies can heal themselves. And we look at, the simplest way of looking at that is, I know that if I eat good food, I'm going to feel better. Right?
Uh-huh.
But, and it's the simplest
Absolutely.
form of your body healing itself. You eat good food,
Absolutely.
you are what you eat. You're going to feel better.
Right.
You eat bad food, you're not going to feel better.
Right.
So what is
you
that?
think good thoughts.
Right. Think good thoughts. Exactly. Actually, there was a study out, I think, that with diabetes, type 2 diabetes patients, that if they watched, was it an hour of comedy, I think, over, before or after eating sugar, a lot of sugar, I think their glucose levels stayed lower than even taking a medication.
The mind is a powerful
It really
thing.
is. So what is the mindset that someone has to be in? How do they change their mindset?
How do they change their mindset? That's a tough question because we're so indoctrinated. People have certain values and mindset based on, what they've been taught and what they've experienced.
Right.
So, Christopher Columbus, my paisan.
Paisano, yeah, absolutely.
In the days of before Christopher Columbus sailed, people thought the world was flat. That's how they lived their lives. Everything was flat, and they thought that you'd go to the edge and you'd fall off. And Christopher Columbus gave people a new perspective. He was able to sail over the edge around the world and come back alive and tell them about it. And then we realized that the world was round. So it really is, it's perspective and it's also knowledge. So that's why I assume you do these shows, is because you want to bring knowledge to people that maybe they haven't been exposed to. So if you live in a world, this is your world, you don't see anything out here. I know I'm the same with certain things. It's like, if I don't know about it, it's like I'm a little bit more suspect.
Sure, sure.
We're all like that. So I work really hard to keep an open mind when somebody presents something new and different to me, that I want to be able to, take in what they're telling me, and I'll assimilate it with what I already know, and then either I'll adopt it or I'll say, no, I don't want to adopt it.
Right.
So there are a lot of people, you could give them all the research in the world about how chiropractic is beneficial to their babies and their children and to them, and they will never go to a chiropractor. I don't think we could take care of all the people on the planet.
Right.
There are not enough chiropractors. There's about 50, 60,000 chiropractors in the whole world. So, there's probably 50, 60,000 dentists in the Northeast.
Right.
Everybody goes to the dentist. 2-year-olds, 3-year-olds now. Dentistry, way back when, was all about pulling teeth and filling and drilling. And then they realized the benefit that they could offer people when their teeth first come in, to check their gums, check their teeth, and keep them healthy throughout a lifetime.
Right.
Chiropractic is on that path. There is so much anti-chiropractic out there, and it's more, I think it's getting better. The newer medical doctors coming out are not telling people don't go to see a chiropractor.
Right.
We want to work in partnership. We want to be part of someone's health care.
Right.
And if they're in crisis care, they have to decide who they're going to, if they need their medical doctor, they go to the medical doctor. They need a physical therapist, they need acupuncture, so I consider all the professions, all the healthcare professions, you can use them in crisis care, you can use them in healthcare.
Right.
That's what I prefer to do, use as much as I can of all the different practitioners, massage, acupuncture, physical therapy, Reiki, shiatsu, all of that. I do all of that because I need to keep my body as healthy as possible.
So 2 things on that front, and remind me if I forget one of them, because I don't want to forget either one. A resource that people can listen to, and then in terms of doctors. So first, in terms of a resource,
Right.
someone I've listened to for a long time is Dr. Joe Dispenza, who's another
Yes.
chiropractor. I love this guy. He's part chiropractor, part neuroscience, and
He's brilliant. He's
he
brilliant.
has it's called Breaking the Habit of Being Yourself.
Yes.
I think you can find it on YouTube. It's like 2 hours long. Put it on your phone, listen to it on the way to work. And this guy explains in such a great way of how your brain works and why it's so hard to change habits. It's brilliant. And I've been listening to him for maybe 8 years, and I still listen to that same, maybe once or twice a year. I'll listen to it in the car on the way to work.
And you'll hear something
I hear
different
something
each
different
time.
every single time. That was the key thing. My wife told me, she's like, don't listen to it just once. Listen to it again and again. And even 8 years, 9 years later, I'm still picking up stuff every single time, because each time, what he says is, every time you have a new thought, you make a chemical, right,
Yes.
in your brain.
Yes.
And sometimes you make that chemical and you start thinking about that, and he's still talking, and you're missing out on a few seconds, which are another
Right.
aha moment the next
Right.
time you listen to it.
Right.
Just like when you learn anything. But he would be a great resource for anybody that wanted to
Absolutely.
explore different ways of thinking about, how they look at their body and how they look at the world and how they look at themselves and how they think. Second part I wanted to talk about was it is difficult when someone goes to their doctor, and I've had these three responses. Chiropractic, doesn't seem to be hurting anything, so it's okay. Or chiropractic, what are you going to chiropractor for? Or, as with, I have a surgeon who, orthopedic surgeon, who is doing a different type of therapy on a rotator cuff injury I have.
Right.
He's like, I see a chiropractor every week, right?
There you
But
go.
I'll give you an interesting example. Is I have I had Lyme disease a couple years ago. Went to my primary care physician, and took a lot of blood tests. Couldn't figure out what it was. She sent me to seven doctors over the course of 9 months. Like literally everywhere in Boston. No one could figure out what I had, and I was having memory loss. I had what is it called? Vertigo. I had when your legs swell up, edema.
Yeah.
My legs. And finally, I'm out at a trade show in California, and my legs swelled up really thick. Had edema in it, and I panicked. And finally, this was 9 months later. My wife had recommended I talk to a naturopathic physician down in Connecticut. He's kind of at Dr. Peters level for naturopathic physicians. And by email, I sent him, hey, these are my symptoms. What's going on? Can I come see you? He's like, you don't need to come see me. You have Lyme disease. Go get a test tomorrow. So this guy diagnosed in 7 minutes what all these traditional doctors didn't diagnose. So when I went back and brought up to my doctor, she was just like, naturopathic physicians. It's like, how can you dismiss someone who has an expertise and cares for other people? So I think for people that go to talk to their doctor, your doctor didn't go to chiropractic school or Reiki school or whatever.
Right.
They don't study that. They studied what they studied. So they're not the best person. And it does make it difficult, I think, for people to go out and figure out what kind of care they need. So sometimes you'll hear someone say, well, I went to an acupuncturist and it was great, you gotta go. And that person goes to an acupuncturist and maybe it wasn't the right method for them.
Right.
So there is that problem that needs to be addressed as well. And again, you have to be in charge of your own care. You can't just go to the doctor.
For yourself. You have
to do that research. And again, sometimes you're going to find research that isn't correct. So you have to know when something isn't working for you to stop and try something different. Don't give up.
Right.
I think is
right.
something you have to have that switch in your head. Like, this didn't work. It's not going to be like, I'm never going to get better. It didn't work. Let me try something different. Let me talk to someone else. And those are the people I think that get better. That's that mindset thing where people sort of get it, that, okay, it's not a perfect world. My body's different than someone else's.
Right.
So.
And I think we have this idea, this persona, with all due respect to whether it's medical doctor, chiropractor, anybody, that we are all human. We're all human, and we have different focuses in our studies. And so with respect to the doctor who misdiagnosed you or didn't diagnose you, it wasn't within her expertise to do that. And so do we make them wrong? No, you kept searching because you knew there was something going on that wasn't being discovered. So I think that's the key point, is that you never stop learning and searching about how you can care for your own body, especially when you're here in this crisis situation. Yeah, and everybody has something to contribute, So, like you said, somebody goes to an acupuncturist and it's like their world is so much better, their life is so much better, and we are all drawn. So now we can talk about something different, like energetically. You can't measure energy, but when you walk into a room and you just feel an affinity to somebody, or you walk into a room and you feel repelled from somebody. It's that I'm talking about. Doctors and patients need to have affinity. If you don't have affinity with the person you're seeing,
Right.
It's not going to work. I remember years ago, Bernie Siegel, a very famous surgeon, cancer surgeon, he said people can heal from cancer by going to a medical doctor. They can heal by going to a chiropractor. They can heal by going to an acupuncturist. He said they have to believe in the method that they are using for it to work for them. So in our society, people place, medical doctors, they give them the highest, kind of respect and regard,
Right.
and then the rest of us are considered like alternative but we are not we all have our own professions that should command respect.
Right.
And a lot of people worry about chiropractors hurting people, especially we're talking about babies, and people think, oh, I'll never bring my baby. I always share people a statistic. Most general practitioners malpractice insurance. So we're going to talk malpractice insurance is what covers you in case there's an injury that you might harm somebody, and most doctors don't harm people on purpose.
Right.
It's an accident, or it's a properly prescribed or properly done procedure, and it didn't go well for that person at that moment. So most general practitioners, it's about $40,000 a year, okay, for malpractice. So the amount is relative to the amount of claims, okay?
Sure.
I pay $900 a year malpractice.
So that's less than my car insurance.
Yeah.
Yeah.
Again, I just want to share with the audience that, insurance companies don't let you get away with, hurting people. If you're really hurting people, you're going to pay a whole lot more malpractice insurance because there are a lot more claims. Right. So I'm part-time. Most chiropractors, full-time chiropractors, pay about $1,200 a year malpractice.
Wow.
Chiropractors, contrary to what a lot of people might think when they walk in my office, they go, I'm here, but I'm just nervous. And I can sympathize with them because there is a lot of misinformation out there.
Sure.
To adjust a baby, I use the pressure of my finger on my eyeball along their spine.
Right.
There have been studies by the International Chiropractic Pediatric Association. That's an organization my husband teaches for that organization around the world, teaches chiropractors how to take care of pregnant women and babies and kids. And we've been doing that for 36 years, taking care of people of all ages. And there have been studies showing that millions of adjustments done on babies and children with no harm, no negative results. So not many professions can say that.
Right, right.
So you'd have to be premeditative, If I really didn't like you, Richard, but then I'd need like a sledgehammer or something, you'd see it coming.
Right. So what I want to do now is,
Yes.
I did go out on Facebook this week, and there's
Yes.
a couple of local Facebook groups for Norwood and Westwood.
Okay.
And I gave people the opportunity to ask some questions.
Okay.
Now, I think in the course of the last 45 minutes, you've probably answered most of those questions.
Okay,
so what I'd like to do maybe is go through these, because I do want to address their questions in a more direct way.
Right.
And we'll do like a short answer for each one.
Okay.
And one of them being a great one.
Don't make them too hard.
No, I would never do that.
No, I'm good.
So the first question was from Elizabeth in Norwood. And once you start having adjustments, do you need to do them forever, like getting a tune-up? I think you talked about that a little bit, but just sort of,
Right.
wrap that up.
Do you have to do anything forever? It's up to you. I will continue to have my spine checked forever on a regular basis. Some people just don't want to do it, for whatever reason. So, no, it's really a personal preference. Do I recommend that people get checked forever?
Right.
Yeah.
I think it's a matter
Not because I want their money.
Right.
I just want them to experience the greatest health and well-being in their life as possible. And chiropractic can contribute to that.
And you
for
don't
people.
always see that tangible difference right away.
You don't.
And sometimes
like
it takes
anything.
going for a while. And sometimes it takes a
Takes a
long
while
time.
to see
Exactly.
this bicep
Exactly.
change.
So the next question is from Doris in Norwood.
Yes.
How do you handle people with advanced cervical disc degeneration who can't have traditional adjustments on their neck?
Very carefully
Yeah.
and specifically. We have many different techniques. We have techniques where we can just hold pressure. We have techniques where we can use an instrument. to be specific. And I have never met a spine that I could not adjust, ever, ever.
Okay, and 35 years, I know you guys have cared for a lot of people in this area, so that's...
We have, and I don't try to force people into the kind of adjusting technique that I do. I find the technique that's going to work best for that individual person.
Right.
So their size, their tolerance level, and so
Okay.
I think that answers that.
Charmaine in Norwood, can chiropractic relieve or cure, is it sciatica pain?
Okay, so you have a sciatic nerve bundle. So
Yes.
there are the last 3 nerves that come out of your spine gather together in a bundle and come down and then branch off to different parts of your leg. That's called the sciatic nerve bundle.
Right.
Usually when people have pain going down their leg, they say, I have sciatica.
Okay.
So it could be inflammation of that nerve. It could be due to many different things. And this isn't a smart aleck answer, but if you have sciatica, do you want to have good nerve energy or crappy nerve energy? Same thing with cancer. If you have cancer, do you want to have good nerve energy or crappy nerve energy?
Right.
So I'm not here trying to cure their cancer or their sciatica. I am trying to allow their brain and their nerve system to function as best as possible, because then you'll get proper blood supply. The nerve supply is better to your body and to your muscles, and
Right.
everything works better. And then, yeah, there may need to go to a physical therapist also, or an acupuncturist, or massage, or go to a trainer and start working the muscles. I mean,
Right.
I had a hip problem myself, and I went to other practitioners, and finally, I have to exercise to keep the degeneration that's in my hip joint, to keep it from being active and keeping me from doing what I want to do. But it's a constant. I have to work those muscles every day.
Right. I think that goes back to the fact that there's no magic pill
There isn't.
for anything, because whatever you take that makes you feel better is almost guaranteed to be temporary, unless you're doing other things to
Right.
relieve the actual cause,
Right.
that initial cause.
Right. We have to do the work ourselves.
Right. This is from Joe. What are steps that patients can take on their own in between visits to reduce the impacts of their conditions? So yoga, specific exercises, what are your opinions on medications, especially some of the more heavy duty ones? And I think we just sort of explored that a little bit.
Right. That's a big question.
Yeah.
Okay. So the advice I give to my patients, I am not a personal trainer. The advice I give them, can I stand up?
Sure. Yeah, let's...
Okay, I'll just sit here and do this.
Okay.
So basically, sitting like this, our lower backs are flat. That's not how they're designed to be. They're designed to have a curve in them. So you want an arch in the lower back.
Yep.
You want an arch in the neck forward. So what can you do during your waking day? You can do this. You're sitting in your chair. You've been doing this, or looking at your computer. Open up. Extend your body. Extend your neck. Feel the stretch here. Feel this compressing there. That's the you want to bring a curve back. You'll notice when you do that, you're going to feel like, I can breathe better, because you're taking pressure off your lungs too. You're sitting like this, your heart and your lungs are getting compressed.
Right, right.
So we need to expand them, allow them to breathe, open up, take pressure off. Just like taking pressure off the spine, you want to take pressure off your organs. So to have a standing table, you could do more than just stretch. You can actually do an isometric where you're pushing forward while you're pushing backward. But you don't want to be in this position, flat. You want to have an arch in your neck as far back as you can and press 1, 2, 3, 4, 5, and do that a few times, especially if you're on your phone a lot like this. If I find myself like that, I usually bring my phone up here.
Yeah.
If I'm reading, I'll put a bunch of pillows and I'll read like this.
Right.
I know it's like some of the kids come into our practice, teenagers, and they're like this, and I'm like, high five. We need to be conscious of that, because it is affecting our children. There's research coming out showing, British Medical Journal said that boys 10 years old, like 10% of them already have degeneration in their neck, in their spine,
Right.
degeneration of discs. That's a problem. If they have it at 10 years old, what are they going to look like in their
Right.
20s, 30s, 40s? Chiropractic adjustments help that.
Right, and I look at, again, there's kids in your office all the time, and I know what it's like to bring my daughter to any doctor.
Right.
Kids have no problem being in your office. It is really, it doesn't feel like a doctor's office. They
Right.
are,
It's
I
our
see these
home.
little 4, 5, 7-year-olds, 10-year-olds, 13-year-olds jumping on the table because they're excited
Yeah.
for that adjustment, and they get it.
Yeah.
So
We don't-
let me keep going because
Go
we're
ahead.
going to
Keep
talk
going.
to our hour here. Daniel, what do mainstream doctors think about chiropractic, and is it evidence-based?
I
Again.
don't know what mainstream doctors.
It's different, I think,
You'd
for
have
each
to
one.
ask your doctor, and like we
Right.
talked about that.
Right.
Some learn about chiropractic, some don't. They make judgments without knowing what we do. They've never spoken to a chiropractor, or maybe they've met up with a chiropractor who doesn't practice like we do. I mean,
Right.
there are chiropractors that practice pain relief, and it's still beneficial to people.
Right.
You
Here's,
know?
here's the simple thing that I told someone the other day, because I had this conversation a couple times. If your chiropractor does not believe in chiropractic,
If
it's
your
okay.
medical doctor
Yeah, if
doesn't?
your medical doctor, sorry. It's okay. You can still see a chiropractor. You let them know,
Right.
I'm seeing a chiropractor. I'm letting you know that because I want to.
Yeah.
They're not going to say, don't go see a chiropractor.
Well, sometimes they
unless
do.
there's, unless there's,
Yeah, and it's
But it doesn't-
disrespectful.
Right.
It's disrespectful because I wouldn't tell any of my patients not to go see a medical doctor. I
Right.
don't do what a medical doctor does, and that's being disrespectful to
Right.
that person and what they feel is being true to themselves. So,
but at the end of the day, they don't typically understand. Just like,
Right,
again, you don't
right.
you
So
don't know
they're gonna
everything they do. They're going to,
Do what their medical
there's a
doctor
level
says.
of when you go to medical school, they teach you one specific thing, and they
Right.
teach you that one specific thing for a reason. Because they
Right.
don't want you to live outside that box.
right,
And that's fine.
right.
You look at the military, it's the same way. They
Right.
teach you something, they want you to live in this box and not outside this box because it's important for that purpose. Same
Right.
thing with doctors. Doesn't mean they just don't know. And
Right,
that's really what
right.
it comes
They don't
down
know,
to.
and so if they haven't been to a chiropractor, it's really, I mean, how much time do you have in your day to be researching other professions?
Right.
So, but just to keep an open mind and be respectful, and know that millions of people go to chiropractors. So there's got to be something good about it. So
Right.
why would you tell somebody not to go if you don't really know
Right.
what that chiropractor and that specific chiropractor is doing in their office?
Right.
So yeah, it's sad for
So
me.
we have one more question before we go to
Okay.
TechNet question.
Okay.
And this is from Leslie in Norwood.
Yeah.
And this is more of a building trust with any type of doctor question.
Right.
How do we know if in fact a chiropractor we should be seeing versus, how do we know if it's a chiropractor versus a physical therapist to see? Leslie had seen a chiropractor, didn't seem to be working, and then physical therapist did. I don't think there was a good level of communication between her and her chiropractor of what the care was. I think Leslie felt that it was, that chiropractor was there to get his insurance payment for his 12 to 18.
Oh.
And I think this is going to come
That's
down.
sad to think
It is
that.
sad to
And-
any
and-
doctor.
And who knows if that is true or not? We can only, people make assumptions, and I'm
Right.
sorry, Leslie, I don't know the situation
Right.
with her. What I will say again, it's that affinity. You have to feel an affinity with any practitioner you go to see.
Right.
And if you don't, then you're more likely to leave. And sometimes people don't have nice things to say for the practitioners when they leave. They'll find something wrong.
Well, I think I think the key point there is because I've been to different chiropractors in the past, and I've walked in and I really got my adjustment, and that was it. Nothing was explained to me. And I grew up
Okay.
I grew up in
I see what
an
you're saying.
Irish and Sicilian family, so I was always told what to do, never told why. And I'm a
Okay.
big why guy. Tell me why, and I'll
Yeah.
get it. So if I sit down with you, which I've done,
Right.
and said, tell me what you're doing to me, explain it to me. Like when you give me adjustment, I can hear you saying, this is number 4, whatever. You're
Right.
going through and adjusting me, and I can hear what you're doing, and you're explaining why. That is
Okay.
huge to me,
Yeah.
because if I'm just thinking, going on blind trust.
Right.
That doesn't always work, because when I leave, there's an expectation that I'm going to feel better. But if I understand what's going on, that means more to me as a patient.
Okay.
Does that make sense?
Yes, and that's just who Peter and I are. I want to explain to people like I would want things explained to me. Okay? So I think that's part of it. I think the other part of it is when somebody leaves a practitioner because it didn't work, you have to really define, what do you mean by it worked or it didn't work? If someone comes to me and they say, Dr. Patti, I want my neck pain to go away, I say to them, like I said before, I can't promise you that an adjustment is going to make your neck pain go away. It's there for a reason, and I'm going to explore what I can do to contribute to helping your spine be healthy, because your neck is attached to many more bones of your spine. It's a whole system, and your skull sits on top of that. So you can't just look at one area and say, I'm gonna just push around this area and fix it. So it depends on what they mean by working. If somebody wants their pain to go away and that's all they want, I say them very respectfully, you could go to a pharmacy and get a drug that's strong enough, you will not feel your pain. Is that really what you're asking for? And then if they say, no, I want to be able to pick up my kids. Okay, let's explore what's going on. Let's do an analysis, see what's going on in your spine. And then I present to people, this is what's going on in your spine. It's not just your neck. You've got stuff going on in your whole spine. Do you want to take care of this or not? And then I'll start adjusting them. If their aches and pains don't go away, it's not that chiropractic doesn't work. Chiropractic is doing what it's supposed to do, which is allowing interference to be taken off of the nerves,
Right.
so that the brain can talk to the body better. But you can have, I had a woman who came in because she had headaches and she wanted her headaches to go away. And I said, there is not a headache button to push. And so I said, but here's what's going on in your spine. Is this something you want to take care of? And she said, yes. She became a patient and stayed under care for 5 years. In those 5 years, she did biofeedback, she did massage, she was taking all kinds of medications, and she still had headaches. And this is a true story. 5 years into care, she comes in one day and said, Dr. Patti, my headaches went away. I was like, whoa, what did you do? She said, it's so interesting. My divorce was final a month ago, and I have not had a headache since then. So we should all stop and really look at that moment. So some people will interpret that, oh, I need to divorce my husband or my wife so my pains go away. I don't know. The point is, there are so many stresses going on in people's lives, right, that as one doctor cannot figure out all the stresses, nor can one doctor take care of, right, all of those stresses that are going on in someone's life.
Your environment on its own can create stresses that make you sick.
Yeah, she's seen
that's
a
a Joe
therapist.
Dispenza thing. Keep watching Joe Dispenza. We're going to move on to our last question here because we're almost out of
Go
time.
ahead.
And Technic, I think, is one of the really big ones, and we're going to try to do this in just a few minutes.
Okay.
But this is what, I work in Cambridge, and I see kids walking around like this all the time,
Mm-hmm.
and I know what it feels like in my neck, and I see
Right.
my daughter doing it.
Right.
We're not going to get rid of this anytime soon,
No.
right?
No.
I'm not going to stop using this anytime soon. I love this thing. It runs my life, right?
Right. Right.
So how can I use this more safely? And there's a great diagram I'm going to put up on the screen here.
Okay.
And it shows a number of angles that I can put my neck and how much weight that's
Yes.
putting down. And I brought this little kettlebell.
Little
Kettlebell, which is, oh God, I'm out of shape. This thing weighs 25 pounds,
Yes.
right? Now, picture holding 25 pounds and having your neck support that. Now, my chin down here, picture this is 60 pounds. That's the worst that it gets.
It amplifies it.
What
Yes.
is that doing to kids, adults, and what can we do to alleviate it a little?
Okay. So I wish I had my spine. But if we're looking at the spine, my neck spine from the side, okay, and the bones are like this, if I have a curve, they go like this, right? What's in between the bones? What's in-
Cartilage. Oh,
called discs,
Discs,
right? The discs are the shock absorbers, and they are designed, they have to be expanded so they can bring in nutrients and stay alive. A disc that's constantly pressed on like this will start pushing backwards, and what's back here is your spinal cord. So that's essentially what's happening. That disc is pushing pushing, pushing, and we wonder why people have swollen disc, herniated disc. It takes years and years, and now it's taking less years. Spines that I'm seeing are more degenerated. Kids' spines are worse than I have seen in the 6 years that I've been in practice. It's this pressure. So what do you want to do? You want to relieve that pressure by putting your neck into this position as much as you can.
Right.
But so if you're doing this, to bail out the boat quicker than you're filling it up, you have to do this more. So you have to do this more than you're doing this. I mean, that's the simple answer.
If you're sitting like this for a while, get up and walk around. Is what
Get
Dr.
up and
Peter.
walk,
Every 10
yeah.
minutes. It's okay. Play your game. Get up every 10 minutes. Walk around. And you know this. This is sort of mainstream is really starting to figure this is a problem. I know Apple just released an app.
Do we have the picture yet?
No, but I'll put it up on the screen. People will be able
okay.
to see it.
Okay.
Apple just released an app on the iPhone and iOS devices, and it explains to you how much you're using your phone.
Yeah.
Because they know that we're kind of using our phones a lot, and there's a harm to it. And then I think the next step is, maybe there's some sort of way we can determine how much we're doing this. Like there's,
like put
keeping it level.
Put a little sensor on
No
our
sensor,
neck.
but you can actually, the way this should work is
Right.
this can tell when I'm
Oh,
doing
okay.
this. So at whatever level, it may say, lift. I mean, there could be
Right.
something like that,
Yeah,
which
like-
I think would be a fantastic
Or just
addition.
get zapped, a little
Yeah, you get a
taser,
electric
you
shock.
know?
I like the electric shock thing. See, this is an hour, and now this is where we get giddy, right? We're going to stop there.
Okay.
I want to thank you so much for doing this.
Thanks,
This is
Richard.
my first time doing this with a doctor. My wife does that stuff all the time.
I feel
but I want
honored.
to leave people with a couple of resources.
Okay.
Joe Dispenza. Listen to him. Breaking the habit of being yourself.
Right.
If you have questions about being a chiropractor or who could someone contact?
Yeah. Oh, they could contact me, of course.
Do. If you're curious about care, obviously Westwood Family Chiropractic right off of 109.
Right.
If someone just wanted to get an assessment, what does that look like?
They would come in. Usually we have gift certificates that we can give people.
Okay.
And 3 times a year or so, we do a special, discounted first visit.
Okay.
So we have Light Up a Life, which is starting next week.
Oh, beautiful.
And people just call the office, and they automatically, during the next 3 or 4 weeks, they can come in for discounted, and then we donate the money to different charities.
I love you guys.
Yeah.
That's fantastic. And if your dog, if you wanted to bring a pet in, same
Yes,
thing, give the
same
office
thing,
a call.
just call.
It's a donation, and then you can
Yes.
bring your dog forever. When I get there
Right.
sometimes on Wednesdays or Fridays or whenever Dr. Peter does that, there's 30 dogs or
Yeah.
pets, not just
And
dogs, but there's
horses.
pets, horses, cats.
Horses.
I mean, it's amazing.
Yeah.
So.
And if people have, you have relatives and friends all over the world, we can find them a chiropractor. So if they want to call me, they're a wonderful chiropractor. Most chiropractors are wonderful. And they're all over the world, and I always help people find referrals to
Thank you.
chiropractors.
Thank you so much, Dr. Patti.
You're welcome.
Beautiful.
Thanks, Richard.
Thanks.
Mwah.